At Thames Hospice, we see many people at home or here at the hospice who are going through very stressful times. We look after people who are living with life-limiting conditions and when they need skillful, compassionate care at the very end of their lives. We also support their loved ones when they're facing or experiencing bereavement. We've been asked by lots of people for some ideas about managing stress in these challenging times. And it really is important that we learn to manage our stress before it turns into a more severe form of anxiety. First of all, in the present situation, it's okay to be sad and confused and worried about it. When we hear of people being unwell, when we worry about our loved ones and ourselves, when our ways of working and our ways of relating and our ways of being are not as they once were, are not as they should be, it's normal and natural to be sad and worried and confused about all of this. So we need to remind ourselves that it's okay not to be okay with all this. But secondly, when we are sad or worried or confused, it's important not to bottle up these things. Express your feelings and your fears. You could do that by writing things down in a diary or a journal. And you can phone someone to talk things through, someone that you feel can help you, someone you trust to help and support you at this time. Thirdly, we need to focus on what we do know and what we can do. We tackle problems by having a plan and by seeing that plan through. And there is a plan. The plan reminds us about regular hand washing, staying home, a daily walk if possible, but keeping a safe distance from others, always, self-isolating if we develop symptoms or if we're deemed vulnerable by age or by other health conditions. And we do know that most symptoms are mild and most people recover without specialised treatment. We also shouldn't underestimate our own ability to cope with big challenges. So we need to focus on what we can do and what we do know. Fourthly, it's important to practice self-care. For example, make time for activities and hobbies that we can enjoy while we're at home. Try to eat a balanced diet. Exercise regularly. Try to have times of quiet and calm in your day. Try and get some good sleep. And I also think it's important to try and limit the amount of media coverage you receive about coronavirus. A daily slot from a trusted news source will be enough to tell you what you need to know for that day. And if your normal routine has completely changed, well, why not plan a new routine for yourself? But be kind to yourself and practice self-care. And fifthly and finally, it's important to stay connected. Social distancing is so important to stem the spread of the virus, but it's also vital to find new ways of staying connected with your family, your friends, your colleagues. And if you are physically isolated, there are ways to stay connected by phone, by messaging, by FaceTime, Skype, through social media. And if it's your tendency to withdraw when you're stressed and when you're anxious, think about how you can stay connected in order to counteract that tendency. Keep in contact with others and stay connected. Please take good care. Thank you.